Welcome to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 7-month-old medium crossbreed dog. The dog has left front limb lameness. On physical exam, you localize this to the elbow. The owner reports that the lameness does improve with treatment, medical management using carprofen, but does get worse after running or exercise. Here I will start by showing two views focused in on the left elbow, starting with the lateral view. And here, the CC view. You all know that when I do my ABCDs, alignment, bone, cartilage, devices, soft tissues, I'm looking for all aspects of the images. When it comes to elbows, alignment, A, and C, cartilage, kind of go together. I'm going to go to the lateral view and show you what I mean. Especially when I'm assessing elbows in juvenile dogs, something that comes to our mind clinically would be elbow dysplasia, and we know that elbow incongruity is a component of that. So I'm often interested in looking at the alignment of the joint, and that brings me into looking at C for cartilage. When we look at the radiographic joint space, we're interested in the radiolucent region between the epiphysis of two adjacent bones at an articular surface. What is in the radiographic joint space is synovial fluid along with the cartilage of both the distal humerus and, in this case, the proximal radius, and of course also the proximal ulna. So the radiographic joint space is comprised of both synovial fluid, articular cartilage, as well as other soft tissue structures such as in the stifle, menisci, and intracapsular ligaments. When I'm looking at alignment of the elbow joint, I want to first remind myself that we are limited radiographically about what we can assess, but I'm interested to know, is the joint space width, so this radiolucent crescent here, is it similar the whole way across the joint? And you can see that it's a very nice uniform parallel joint space here between the humerus and the radius, and it's a little bit less well defined, and that's just due to the shape of the distal humeral condyle as we come up here at the trochlear notch. Some radiographic views you catch a radiolucent crescent through the trochlear notch a little more clearly. In this one, we have some slight obliquity. I'm going to show you how I look at alignment on this view. On this view, when I look at the radiographic joint space, I see that this part of the joint has the impression of being slightly wider, so that radiolucent part is a bit wider than this part of the joint. So maybe there's a little bit of a difference in the joint space between the humeral ulnar part here and the humeral radial part, but I would be very cautious about that because there's definitely some obliquity here. The reason that I'm interpreting obliquity is I can see sort of a gray zone instead of a solid lucent black, and that tells me that there's some superimposition. Of course, when we're looking at elbows, another thing that is of interest would be the Ankino process. The Ankino process is this part of the ulna here. I always call it a beak because that's what it looks like to me. The Ankino process of the ulna has its own center of ossification in a juvenile, which should fuse by about 6 months of age. So in this dog, we can see that it's entirely fused. If you're wondering about what this feature is here, don't be fooled and think of this as a persistent issue with the Ankino process of the ulna. This line, if we continue to trace it, you can see that it makes this right angle and it continues to be part of the distal humerus. The medial epicondyle of the humerus superimposes on the Ankino process on the neutral lateral radiograph. On the flex lateral radiograph, you can see that the medial condyle of the humerus gets out of the way, and we see an unobstructed view of that beautiful beak of the Ankino process of the ulna. Now, what about the medial coronoid process? Many of you will have heard when you're looking at radiographs of the elbow in order to assess the medial coronoid process that you want to see if it looks sharp or ill-defined. This is the region where we look at the medial coronoid process. On this lateral view, it's always going to be superimposed on the proximal radius. The reason is that on the two-dimensional representation, the medial coronoid process actually wraps around the proximal radius in 3 dimensions. So when you look at it on the 2D representation, they'll always be superimposed. I'm going to quickly show you where the medial coronoid process area is on this view. Let's get rid of my orange arrows. So the medial coronoid process on the orthogonal view is going to be at the medial aspect of the joint, which is here, and it's this portion of the ulna that sort of sticks out on the most medial edge. In this particular view, this is actually a relatively straight CC view. We can use slight obliquity in order to make the medial coronoid process stick out a little bit better, but this is the spot where we would look for that. And you'll recall that adjacent to that, that distal aspect of the medial humeral condyle is where you'll want to scrutinize really carefully with your eyes for any evidence of osteochondrosis, because this would be a predilection site for that. In order to understand a little bit better what exactly we're looking at when we're hunting for that medial coronoid process here on our lateral view, I'm going to jump quickly to a CT. What I want to show you is what this would look like in 3 dimensions. Here we have the CT of an elbow, and I'm just going to pop it into view for you. When I'm looking at the medial coronoid process, essentially what I expect to see is that it's going to be a C-shaped structure that hugs around the proximal ulna. I'm going to move. Here we go. So this is a transverse image through the radius and ulna just at the floor of the elbow joint. The radius, I essentially always think of it as a straight post. You can see it's not perfectly round, it's kind of an oval, but this is what the radius looks like in transverse section. The ulna is also, of course, a long bone, so it's essentially also kind of post-like, but the ulna and radius are very close together, and the way that they accomplish that is that the proximal ulna actually hugs around that round shape of the radius. The proximal ulna hugging around the radius creates the medial and lateral coronoid process. I'll show you what they look like as we scroll through. So as we go distally towards the mid-antebrachium, you can see the radius and ulna are separated. And now I'm scrolling proximally. You'll see that they're coming closer together and that the radius is taking that oval sort of post shape and that the ulna is hugging it. The hugging that it does, it accomplishes by having a little edge here and a little edge here called the medial and lateral coronoid process. So this is the medial, and the lateral one is always much, much smaller, and we usually don't even appreciate that radiographically. Now, what I want you to think about is the opacity, or the density is the word we use on CT, of this feature here. You can see that this is very sclerotic medial coronoid process, but it does still seem to be attached to the body of the ulna. So in this case, we would say that the medial coronoid process is blunted. You can see it's kind of round, that it has increased opacity, but that there's no obvious fissure or fragment. So when you pop this onto a two-dimensional radiograph, you're essentially left with sort of the impression of, again, we're looking for that sort of hugging around the proximal radius. So here's our proximal radius, that nice sort of straight post. The impression of maybe a sclerotic area here, but certainly very limited ability to assess that and make any definitive statements about it on these particular radiographs. Occasionally we do get lucky on radiographs and we can really clearly see a fragmented medial coronoid process, but more often than not we require CT. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.